Hello, 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 and welcome to our Facebook Live at 5. We're now changing our name, so you'll know. Our name is now going to be Nursing News You Can Use Live at 5. Nursing Business and News. So I wanted to make that announcement again. I'm Tina Baxter. I'm the hostess. Welcome to those that are on our Baxter Professional Services page, and those of you that are on our Nurse Shark Academy page, and those of you who are watching via YouTube when we get this put up. So I want to say this, starting at the beginning of the year, we're going to start posting all the videos at over to YouTube. We started moving some of the older episodes over to our YouTube page, but I wanted to let you know that that's coming. But it's going to be nursing news you can use. We are changing our name and rebranding from Facebook Live at 5 because we'll be also posting our information on other places. And so I wanted to make sure that we get good SEO for that. And so now we're changing our name to Nursing News You Can Use. And also, that is the name of our newsletter on LinkedIn. So we're going to make sure that we're tying that brand across the way. All right, let's get started with our affirmations for today before we hop into our business segment. So, this is again from the Louise Hay affirmation calendar. And yes, this is the last time for this year that we'll be using her calendar, because we do have another calendar that we'll be using for next year. But I thought that this was great, and I wanted to leave you with these three affirmations because I think these are awesome. Number one, each day I express more fully the inner beauty and strength of my true being. Each day I express more fully the inner beauty and strength of my true being. Number two, I succeed in everything I want to do. I succeed in everything I want to do. And number three, I trust life and know that all is well. I trust life and know that all is well. Those are our affirmations for today, December the 28th, 2022. All right, let's get back into it, into our leadership moment and our What I'm Reading segment. So I happen to have this book um, called The Law of Divine Compensation by Marianne Williamson. And I found the first chapter very interesting. I just started to read some of her book, and it's very interesting to me how it lines up with some kingdom principles. And I know that some of these principles um, are universal. The principles are universal, and that oftentimes we miss things because we don't recognize them for what they are. But I find this interesting. So I'm going to go ahead and read some of this and share with you so you can get the information. And again, she's not paying me to share the information. I don't have any endorsements for this show. I just happen to find things that I like and I share them with you. All right. So she says the universe is set up to work on your behalf. The world is not a giant, uncaring, random expression of biological processes, but rather a living, breathing reflection of love for all living things. The universe itself is miraculous. And when you think about how the world was set up to support us as human beings, I can't help but say, yes, the world is miraculous. Just thinking about that makes me wonder why we don't embrace the miraculous more in our lives and see the world for how miraculous it is. So let's go on. She says, spiritual truth is always at work. Beyond what the eye can see, it describes an invisible other world that exists in a realm beyond our mortal circumstances. She goes on to say that we transform our mortal circumstances by bringing our thoughts about them into alignment with a world that lies beyond. And I was having a conversation yesterday when we were talking about all things, my background and things like that. I was a guest on a podcast, and we happened to touch on some of these universal truths. And I was telling him this story of when I told my high school calculus teacher, who was a very brilliant man. He's a very intelligent man, loved math, got very excited about math, way more excited than I ever would. Um, but anyway, I had told him that I could conceive of time travel being real. And he said, "Oh, I can't work out the math for that." And I said, "Well, if you understand that time is a construct and that time can be manipulated because it's a construct, then time travel is possible." And we were discussing that. And I was thinking today, I was having a conversation today with my mom, because we were talking about, just time seeming to have gone by so fast. It didn't seem like it was that fast. And I was, telling her, yeah, when the COVID hit me in the pandemic, every day seemed to be the same because I had the same routine mostly every day. So I didn't know what day of the week it was half the time. And because my concept of time changed when the pandemic hit, because we were getting up, going to work online, doing the same thing pretty much every day. And I said that because time to me, can be manipulated. And so that's what I was telling him. I said, if you look at it from a metaphysical, a spiritual aspect, their time travel is possible, but my very rational calculus teacher could not get it. But it's how we think about what's happening in the world. She says, no matter what is happening in our lives, we choose how we wish to think about it. That's the power of choice that we have. And the greatest gift we give ourselves is often our willingness to change our minds. Despite what might seem to be the saddest and the most intractable situation, we have the power to believe that something else is possible, that things can change, that a miracle can happen. And my question to you as we head into 2023 is, do you believe in miracles? And I happen to say, pardon me while I turn this light on, that I do. I believe in miracles. All right, so that's the What I Am Reading segment. Again, this is Marianne Williamson, The Law of Divine Compensation, and I'm happy to share that with you. I know it's available on Amazon and other places where you purchase your books. Let's get on with the news because we've got some important, fun stuff to talk about today. Getting excited for the new year. Excited for the new year. Okay. So let's look at our first story. It's coming from National Public Radio. This is something that we know far too much about. What I mean is that we've talked about this so much in the healthcare realms that it's really sad that we continue to have to report on this. And it just makes me think all the more about how far we have to go. But this is coming from NPR. It came out on the 27th, and it says maternal deaths in the U.S. are staggeringly common. Personal nurses could help. And that headline hit me straight between the eyes when it says staggeringly common. You would think that in what's happening, we've covered the TikTok nurses complaining about their icks in the labor and delivery. But when you think about this, you think about that, it's often said that when you're giving birth to a child, you have one foot in the grave. It's really telling. So I'm just going to read you some of the story. You can certainly listen to it on NPR and follow along. And it says, in 2020, Lauren Brown of Upper Darby, PA, had a high-risk pregnancy. She was past 35 years old, had high blood pressure, and had a previous blood clot that could have been deadly. Plus, the COVID-19 pandemic was raging. When it came time to give birth in December that year, Brown, 40, needed an emergency C-section to deliver her baby, her daughter Bella. All of these factors contribute to a deadly trend in the U.S. The country has long stood out for its high rate of maternal mortality among wealthy countries, an issue that disproportionately affects Black Americans. The coronavirus pandemic only pushed deaths higher. But Brown, who's Black and a first time mom, had an experience that points to solutions. She says, "It was a little scary, but being that I had the nursing group, I had my whole team at the hospital. I really felt like my pregnancy was very smooth," she says. I wish you could see the pictures because her daughter looks very lovely. She's so cute. So, Brown and Bella are just one of the 5,600 families served by a national program called Nurse Family Partnership each year. That model, first studied in a randomized controlled trial more than 40 years ago, pairs low income first time parents with a personal nurse from pregnancy through their child's second birthday. It's an expansive goal to help create healthier and more prosperous families. In Brown's Pennsylvania neighborhood, the program is run through a local community foundation called the Foundation for Delaware County. It is one of 774 counties across more than 40 states where the program is run. Part of that work involves improving pregnancy outcomes for birthing parents and their babies. Brown worked with nurse Christina Baker before, during, and after her pregnancy. They could not meet up in person for more than a year due to the pandemic, but Baker kept tabs on her patients' blood pressure, stress levels, and doctor's appointments remotely. I think that's wonderful to have that program supportive of moms. And I think one of the reasons why we have such a mortality rate is we don't give moms the leave that they need. We expect you to have that baby come right back to work and get on the job and all those different things. And it's just other countries allow more more time and they give more care to their citizens because they recognize that having healthy citizens, having healthy baby, healthy families only strengthens their country. So the article goes on to say that research points to early education about pregnancy complications and multidisciplinary care for women with extra risk factors as key interventions to improve maternal health outcomes. The Nurse Family Partnership model does both, with an emphasis on empowering expecting parents to demand better care if they feel health professionals are not taking their concerns seriously. Okay, I'm going to have to stop there because we just had on TikTok African American female who came in to be seen in the ER. She was pregnant and had some concerns, and the nurse was rude to her, got her kicked out. The doctor was rude to her, dismissed her. And I want to say this is a problem. This is a problem because a lot of times healthcare providers, and I am one of them, we can sometimes be biased. We sometimes don't listen to our patients. We have our preconceived notions about how things are going to go. And oftentimes, the patients who advocate for themselves, we label them as problem people. So, what can we do to change that perception in the healthcare field is by making our patients partners in their care. Brown goes on to say she was comfortable asking questions, but many first-time parents struggle to do that. Baker says, "One thing that I stress early on is that you need to advocate for yourself because this is your baby, this is your pregnancy," she says. This extra attention and advocacy gets results. The Nurse Family Partnership model lowers the rates of some maternal mortality risk factors such as pregnancy-related high blood pressure according to the studies of the program's outcomes. So I think that is wonderful, and I wish every mother had that. The article says a recent review of recent pregnancy related deaths in the U.S. found that the mental health conditions are a leading cause of mortality in the period up to 1 year after birth, according to the CDC. That same review found that 4 out of 5 of all deaths during or after pregnancy are preventable. That is telling. The goal is also talking about expanding access to Medicaid. Would also increase the reach of the nurse family partnership programs, according to that organization, because Medicaid dollars can be used to help fund them, which would be nice. You would think that that would be available. The cornerstone of the nurse family partnership model is building a trusting relationship. Trusted supporters, whether nurses, doulas, or midwives, can help lower the rate of birth complications and address the racial differences in birthing care, studies show. So I found this article. I thought this was interesting. You can certainly read more. There's a lot more to this from NPR, but I thought that was great. An article by National Public Radio, and I wanted to share that with you. I wanted to share this also with you because it's about parish nurses, and I happen to be one of them. It says parish nurses provide an important connection to communities in need, but few of them remain. From Milwaukee Journal Sentinel. Parish nurse Julia Means was at Clinton Rose Senior Center in Milwaukee when a resident approached her about a neighbor who couldn't get out of bed. Means, a nurse with Ascension, Wisconsin, went to visit her. The neighbor, an older woman, hadn't gotten up for 2 weeks. She couldn't take care of herself. She was so weak that she left her front door open because she couldn't answer it. I don't know what to do, the woman's son told Means. Means persuaded her to go to the hospital. After some tests, the doctors immediately knew what was wrong. The woman had stopped taking her thyroid medications, a drug that can cost pennies a day. A week later, Means went to visit the woman at the hospital. She had a smile on her face and was walking up and down the halls. She told Means that she couldn't believe it was all because of not taking a pill. The woman, like many others, is an example of someone who didn't understand her medical condition. An estimated 50% of people do not take the medications as prescribed. Means work to ensure that doesn't happen. So parish nursing moves beyond the four walls of a hospital and brings health care to where people live. It works to improve health and lessen the gap between those with the lowest incomes and those with some financial security. Means has been at the forefront of making health care more accessible in Milwaukee for more than 25 years. In 1996, when parish nursing was relatively new, Means became the first parish nurse for what is now Ascension, Wisconsin. A parish nurse is a registered nurse who works in a community and within the pastoral department of a church. Parish nursing started in the 1980s and was officially recognized in 1998 by the American Nursing Association. So again, as a parish nurse, I just wanted to say kudos to her for this and to share the important work that parish nurses provide. As a parish nurse myself, I've had the opportunity to go to someone's home and found out that she wasn't taking her blood thinners because she couldn't afford it, but because it was a very expensive new medication that didn't have a generic, but she never bothered to tell the doctor, and she was at a severe risk of having another stroke. So it's having those conversations that was helpful, and to make sure that she had food available that she could eat and heat up. So those were some of the things that we worked on. So there's more to this story. I didn't want to read the entire story. I want to encourage you to read it. And if you want to know the story about this parish nurse, I think it's wonderful. The problem is that a lot of the parish nurse programs aren't getting the funding, and it's very hard for um, churches to afford having a parish nurse on staff. So a lot of it's done by volunteers. So it would be really nice if uh, health insurance would be able to provide that. And so the article goes on to say Um, that one of the reasons why there aren't more parish nurses is that money, right? Health insurance does not cover the services that parish nurses provide. Buchanan, one of the sources, said that when health systems are making cuts, justifying the cost of employing parish nurses is difficult because their successes can be hard to measure. In recent decades, health systems have also focused on expanding in affluent suburbs and on providing costly services that generate the most revenue. And we've covered this last week about hospitals popping up and looking where your hospitals are building. They're building in the suburbs in affluent areas, which leave places where they need the most care vulnerable. With the exception of Children's Wisconsin, health systems have few, if any, clinics in Milwaukee's poorest neighborhoods. Care instead is largely provided by community health centers. It wasn't always that way, Means said. Milwaukee once had small clinics throughout the city, and people knew their doctors. We used to have tentacles in our community where people went and got health care, she said. That's all gone now. But Means sees a way forward. It's more boots on the ground and more places where people can get care, such as simply getting their blood pressure checked to keep them out of the hospital. Milwaukee also needs safer neighborhoods where people can exercise and better access to healthy, affordable food. She says we are only as healthy as the community that surrounds us. She said, and I happen to agree with that. And I would love to see our health systems invest more in parish nurses. I would also like to see our communities invest more in providing healthy access to food and decreasing the food deserts, of which I live in one of them. So there are a lot of things that we can do to make a healthier society. We just have to have the will and the fortitude to do so. Our next story comes from the New York Times. And I applaud the New York Times for celebrating the ICU nurse, and they call it a symbol of endurance. So I'm going to read some of this information to you. Share this story from the New York Times. It says, an alphabet soup of respiratory illnesses has been spreading misery across the United States, once again pushing hospitals to the brink. But Gina Oppenheim, an intensive care nurse in Santa Monica, California, was taking it all in stride last week as the bed count at Providence St. John's Health Center continued the ominous rise that had begun around Thanksgiving. Like countless other healthcare workers throughout the country, Ms. Oppenheimer, 35, feels emotionally battered by the past 3 years and the loss of so many COVID patients under her care, many of them young people who lingered on life support for months. But as family members of those patients texted her with holiday greetings in recent days, Ms. Oppenheimer found herself feeling oddly comforted even as she was subsumed by melancholy. I still value the fact that I can connect with those people, she said, noting that before the pandemic it was unusual for ICU nurses to stay in touch with the relatives of those who didn't make it. In this case, it's like we're the only link they had to their loved one. It's an experience we share. Nursing is in crisis, fueled by burnout, exhaustion, and politicalization of a virus that left many frontline workers feeling unappreciated and at times abused. But the tale of how the pandemic has decimated hospital staff counts and dented patient care tells only half the story. For every bedside nurse who has left the field or transferred to a less stressful job at an insurance company or a school clinic, there are stalwarts like Nick Vargas, Benicio Dioso, and Mariana Marquez, who, like Ms. Oppenheimer, have endured and in some cases thrived. At its core, if you love your job and that's why you became a nurse, as long as you take care of yourself and you have good people around you, you're going to come back to nursing, Ms. Oppenheim said. That's how I look at it. And so I'm not going to read the entire story, but I wanted to point that out and share that it's nice that nurses are getting recognition. This is a wonderful New York Times article, and I'm going to encourage you to read this article and to share it. While we're in New York, let's talk about this article that come up. This is an article of coming about New York because they're getting ready to enforce their nursing home staffing minimums. And so there's a lot of concern that it won't be sustainable. So, according to this report, it says New York will soon begin enforcing its 2021 state law establishing staffing minimums at nursing homes, despite concerns the effort could turn the upstate hospital capacity crunch into a crisis. Nursing homes will face fines up to $2,000 per day for failing to meet the new staffing levels and related financial standards. About 75% of the state's roughly 600 nursing homes have been violating the standards as of earlier this year, industry officials said. In other words, hundreds of nursing homes either must hire more staff or reduce their number of residents to avoid fines in the coming months. State health officials also can waive fines in specific communities based on a formula for declaring a local labor shortage. Enforcement of the staffing minimums have been previously delayed for nearly a year amid executive orders and legal challenges involving the law. Meanwhile, many nursing home operators asserted that they are struggling to attract and afford new workers. Some have already been rejecting new residents, leaving hospitals upstate facing bed shortages due to scores of well patients awaiting placements at nursing homes. So again, this is something that's going on. We're going to see what happens in New York, and because once some things start happening in one state, if it's successful, you can see other states adopting some of these things. Um, I want to go on a little bit on the story. It says that one of the nursing assistants, Anisha Brown, at Yorktown Nursing Home, and a union member spoke in support of the law. She disputed that many nursing homes can't afford to hire more workers, adding, understaffed facilities harm residents' care. She says, I feel terrible that I cannot do my job. I have not been able to give my residents the care they deserve. And so that's what we're talking about, is being able to give that care. So here's what the law requires in New York, just so you'll know. It says the state law, which was approved by former Governor Andrew Cuomo, requires every facility to maintain daily staffing hours equal to 3.5 hours of care per resident per day by a certified nurse aide, licensed practical nurse, or a registered nurse. The law also requires nursing homes to spend at least 70% of revenue on direct resident care and at least 40% of revenue on resident facing staffing. Enforcement of the measure will be closely watched in 2023 after USA Today Network revealed the history of nursing home complaint backlogs in New York, as well as regulators' failures to penalize nursing homes for flouting federal staffing rules. For example, government penalties for insufficient staffing are rare in the state of New York. Other facilities reporting levels below those expected by the Medicare formula, only 3% were cited, USA Today reported recently. So we'll be looking into this and keeping an eye on what happens here. In other news, I found this quite interesting. This is coming out of from the ConwayDailySun.com, and it says county nursing home administrator stunned by firing. And so let's get into it. Patty Kane, the former assistant director of nursing at Mountain View Community Nursing Home in Ossipee, is still in a state of disbelief after she was abruptly fired last month after 12 years of service and in the middle of a staffing crisis. County officials say the decision was strictly business. Kane of Wolfboro, who says she has 44 years of nursing experience, worked at Mountain View for about 12 years. She was in management at the nursing home, third in line behind Administrator D. Brown and Director of Nursing Sue Dodier. Most of Kane's duties entailed staff development and scheduling and updating policies and procedures, as well as direct resident care. But that all came to an end on November 9th when Kane said she was summoned to a meeting with Brown and Human Resources. Kane was told that she was done and asked to pack up and leave the building. On December 1st, she confronted Carroll County Commissioners who oversee the budget for the county-run nursing home about her firing. She spoke with the Sun about it on December 20th. She says there was no warning and the decision was made without any discussion with the director of nursing. She said she asked if she could apply for another job at Mountain View, but they told me no, I could not work in the building. I found that quite interesting that she can appeal her firing according to the article, but I find it interesting that if you're having a staffing shortage, maybe eliminating her position as her assistant director of nursing is one thing, but why wouldn't you not want to use her in another capacity? So this is the reason why I'm bringing this up, even though it seems like an individual issue here, is because we've been covering stories across the country where county-run nursing homes are closing because the county is not wanting to pay for this care anymore. And according to the county officials, it says that it was budgetary. It was up to the nursing home administrator. One of them wanted the position to be taken out. It's over $100,000 a year, is what she was making. Um, She goes on to say that their staffing is at critical level. She said, this is what Brown is saying, given the economic situation, a lot of staff are able to find higher paying jobs, even in fast food or store clerks, and can make more money there than they can make anywhere here caring for the elderly. She said that the nursing home has about half the nurses it should have, which means staff are putting in a lot of overtime, and management is taking on extra work as well. Per shift, there should be 16 licensed nursing assistants to provide all the daily care of residents, but there are only 4 licensed practical nurses, 4 medication nursing assistants, and 1 nursing supervisor. So it's going to be interesting to see what happens out of this with her case. But this is just a glimpse into what's happening across the country and what we're facing. And so I wanted to show that as an example of what's happening in long-term care. All right, let's get to the next story. And this is a nurse who's making a difference. So this says nursing professor starts gratitude project to combat nursing shortage and burnout. This is coming out of Dayton, Ohio, from Spectrum News 1. It says hospitals are now relying on recent graduates to fill nursing shortages, but there is also a shortage of students entering the field too. That's why one assistant professor is trying something different in her classroom to keep more students in the field, and she says it starts with giving thanks. Sandra Holland is a long-time associate nursing professor at Wright State University in Dayton. She teaches in classrooms designed to look like a real hospital, but just like in a real hospital, she said there are fewer students who want to be nurses. Not as many, and that is reflective of COVID. We always knew there was going to be a nursing shortage as the population ages, said Holland. With nurses retiring and leaving the field over burnout, creating massive shortages, she decided to try something different in her nursing classes. I would post something on my PowerPoint and say, "What are you thankful for today?" said Holland. She said when students get back from Christmas break, she'll continue to include lessons based on what she calls the Gratitude Project. It's a lesson on giving thanks to reduce stress. Well, focusing more on the positive can turn your mental health around and turn your outlook around and improve wellness throughout. She hopes that if students can learn simple ways like giving thanks to relieve stress, it's more likely they'll go into the field knowing what to do when they're put to the test and real life situations. So it's quite interesting to see what's happening, but places we're trying to figure out what's the best way. And I'm all in favor of being grateful. I just did a 30-day gratitude challenge. So I am all in favor of maintaining gratitude and all the things that we can do, but I'm going to say it also goes back to changing systems. All right. But let's talk about some other things that people are doing to combat the nursing shortage. This is an article that came out from U.S. News, and it says foundations, major donors tackle nation's nursing shortage. As more nurses leave their jobs in hospitals, efforts to ensure that more stay in the profession and get more out of the job than just applause and pats on the back that they got during the bleakest days of the pandemic. Yeah, a little bit more than pizza parties and trinkets would be nice. Philanthropic pledges announced this year to help nurses and the nursing profession include 125 million donation in February from Leonard Lauder, heir to the Estee Lauder cosmetic fortune, to the University of Pennsylvania to create a tuition-free program that will eventually train 40 nurses a year. The gift is designed to extend for decades. United Health Foundation, which said in June that it would devote $100 million to finance the training of 10,000 nurses and other clinical students who are people of color or have low incomes. The Robert Wood Johnson Foundation added $3.8 million to its Future of Nursing campaign, a 10-year effort run with AARP and the AARP Foundation that has made some nearly $70 million in grants. The latest attracting people of diverse racial and ethnic backgrounds to the nursing profession. The American Nurses Foundation announced it in May that it's a $19 million commitment, which the nonprofit hopes can help make nurses' lives easier and improve their ability to provide top-notch health care. Projects include programming robots to take care of some of the routine aspects of nursing and provide extra training to nurses before they're thrown into the pell-mell of the hospital floor. That extra instruction could help nurses like Moro Hamed, who worked grueling hours in the difficult circumstances through the early stages of the pandemic. Fresh out of nursing school and on the COVID-19 ward at Advocate Lutheran General Hospital in Illinois, Hamed was struck with fear. The building was on lockdown, frustrated patients were isolated from their loved ones, and Hamed and her exhausted colleagues reused the protective masks for days, worried that supplies would run out. Afraid of infecting her family, Hamed slept in her parents' basement between shifts for the first 9 months of the pandemic. So, again, some of those issues are coming up, so they're putting together some more resources for nurses. And I think that's great because we definitely need that. Other things are coming up to curb the loss of nurses. Foundations have adopted a number of strategies. Some grants have gone to scholarships so nurses can graduate from school debt-free. Some provide specialized training so nurses can provide better care or land in decision-making positions at health providers. And other grants have provided mental health counseling and paid time off and retreats so nurses don't feel burnt out. While people have always thought highly of nurses, that appreciation has not translated into the kind of support from philanthropy as other aspects of healthcare, including doctor training, medical research, and drug development. Philanthropy needs to step up with more grants, or nurses will continue to flee the profession and public health will suffer. So I'm grateful for what they're doing, and I'm so glad that they're now turning an eye to nursing. It's really disheartening when, when I was in school to hear that the money for nurses to help pay for their training was dried up, and that the scholarship that was available is no longer available because the money dried up and there's no way to get more. And that's really sad to hear. So for our next nurse making a difference, I did want to share this. This comes out of West Virginia, and it says deaf West Virginia nurse embraces job at Charleston Hospital. Over the last few years, nurses across the country have had to cope with multiple issues like COVID-19 pandemic and the nursing shortage. They've taken a toll on healthcare. But one nurse who works at CAMC is making a difference and is an inspiration to nurses across the country during the holidays. Nurse Rachel Penzinger uh, applied for school up in Pennsylvania after she graduated from high school nursing school, and they basically told her she couldn't be a nurse because she was deaf. Deaf. However, little they knew, being deaf is not a disability; it's a culture that approximately 36 million Americans have. So Rachel went for not only her bachelor's degree but also her master's, then began working at CAMC at the start of the pandemic. She says, "You have doctors that have accents, and on top of barely being able to understand you, I can't read your lips because of masks, but I made it work, and CMAC has made it work," Persinger said. While working at CAMC, Rachel was able to step in and break that barrier, giving the deaf community relief when they needed it most. So she is our nurse making a difference because of her perseverance and in doing the things that she needed to do to become an excellent nurse and advocate for herself. I applaud you. Thank you for opening up the door for nurses with, and I guess not a disability, but a different way of communicating. And I want to thank you for that. That is all of our stories for today as far as our news stories. Let's get back into our announcements for this month. Coming up in the month of January, we have January 2nd, 3rd, and 4th. Our I'm Ready Nurse Business Challenge. I'm excited. I can't wait to get into our challenge because we're going to celebrate the greatness that was 2022. We're going to celebrate our wins that we had for the year. Then we're going to turn around and we're going to do some mindset work to get us ready to set those big goals in the third day on for 2023 for our businesses. Join me for this. It's free. If you now, I want to say this: if you can't come and be there live when we're doing it live, don't worry. The replay will be there in the group. We're going to leave the replay up. Okay, so the replay will be up when you're in the Facebook group. You'll have a chance to watch the replay. You'll get access to the worksheets. So don't worry if you can't make it at noon on Monday. That's okay. Watch it in your PJs later that night. But let's get ready to have a great 2023. So we have our I'm Ready Nurse Business Challenge coming up. Also, for the month of January, we have our Legal Nurse Consulting Basics course again. Yes, we are offering that course again, and you can get your tickets. It just went up on Eventbrite, and you can get your tickets for that as well. And then just a reminder that we do have our Nurse Shark Academy show. Is now live. Our next episode will be coming out soon. But if you're a nurse and you own a business and you want to be featured on our podcast, then give me a comment, leave me some information, and I'll get back with you and we'll get you scheduled to tell your business story about how you as a nurse own your own business. That's what we want to do. We want to highlight and celebrate you. So join us for those events and join us on the podcast. I thank you for tuning in. Have a great rest of the week. Have a great rest of the year and a happy new year. Many blessings to you. Goodbye.